My name is Sofia Nepembe. I'm a medical officer we're currently working under the Ministry of Health and Social Services. I'm based at Intermediate Hospital Oshakati, and I work in the Internal Medicine Department at Intermediate Hospital Oshakati. The prevalence of diabetes in Namibia to be around 5% in the males and 5.8% in females. But what's of note is that in 2016 or 2012, about 53% of the Namibian deaths were attributed to non-communicable diseases. And of these, 21% were attributed to cardiovascular diseases and 4% to diabetes. So it's quite a huge number of patients or a huge number of deaths which are attributed to these. Whether we have enough specialists, I don't think so. Because most of our hypertension and diabetic clinics are run by nurses and medical officers. But one of the specialists that I work with at the hospital is a diabetologist. He's the only one that I'm aware of. So there's still a need. We definitely are in need of specialists in the field of diabetes and hypertension. I felt quite privileged to have been nominated and eventually winning the Merck Diabetes and Hypertension Award. Felt that it awarded me the platform to advance my understanding specifically in preventative cardiovascular medicine. So I was very, very privileged and felt happy and excited to have received this award. After having won the Merck Diabetes and Hypertension Award, I specifically went to do the online postgraduate diploma in Preventive Cardiovascular Medicine, as I kind of have a passion for cardiovascular medicine specifically. And I feel that it's going to advance my understanding of cardiovascular disease. And it's a postgrad diploma, so it's just going to add more to my resume and my CV. So yeah, I don't think you can undermine a postgraduate diploma. It's a diploma or qualification at the end of the day. So it has greatly impacted my career, and I think it has broadened my understanding of cardiovascular medicine and will eventually help me in treating my patients better and coming up with a proper management plan for the hypertensive and diabetic patients. Throughout the course, it's a year course, and it's divided into 6 modules. Each module is focusing on a specific thing or entity in terms of cardiovascular medicine. So beginning already from the first module, my understanding has already been broadened, and already even before completion of the course, I was already it has already sort of improved my care and my management towards my patients, dealing with the different entities of the modules as we went on with the program or with the course. So I didn't just wait to finish the course before I started changing the management of my patients. It was already from day one as I was doing the modules and gaining a greater understanding of preventative cardiovascular medicine. I started changing the way I manage especially my hypertensive patients, making sure that lifestyle modification is greatly advocated for. And I was more involved in teaching the patients. Whenever I have a patient with me, I'll make sure that they understand the disease, the importance of lifestyle management or lifestyle changes. And then we had a proper follow-up plan, making sure that they get yearly tests done to check if their diabetes is well controlled or that their hypertension is controlled. So I think, yes, it has greatly impacted in the way I manage my patients. And since I'm also involved in teaching the interns, I was able, through greater understanding and gaining knowledge, I was able to also influence my interns to improve their knowledge on the care of the diabetic and my hypertensive patients. One thing I must say is that do not underestimate an online program. It's not as easy as it sounds. It requires dedication and a lot of efforts, and you have to really cut down on some extracurricular activities to make sure that you post in a timely manner and so forth. So it's not as easy as it sounds, and it's quite time consuming, and you need to be dedicated. But it was quite an experience, one which I cherish, and I do not regret it for one single second. At the end of the day, I emerged with a postgraduate diploma, and that's something I'm very, very proud of. And the support is quite great. You have student support, even from the Merck Foundation alumni. They are willing to offer support, and they are always there to assist if you have questions. So you are not completely alone. And I would totally recommend it to anyone, every medical doctor out there who wants to pursue this course. Highly recommended. I'm really, really, really thankful to Merck Foundation for having awarded me the Merck Diabetes and Hypertension Award, and really giving me a platform to attain this postgraduate diploma. I think I'm probably, if not one of the very, very few in my country to have done this online postgraduate course, and it puts me in a position to impact on my country and to change the management or the face of non-communicable disease in our country. So I'm really, really privileged, and I'm thankful to Merck Foundation, as they catered for all my funding. I didn't have to worry about funding at all. So I'm truly, truly thankful, and I just hope that they continue to award more individuals or recipients in my country, so that we change non-communicable disease, or the care of non-communicable diseases in my country.